Hi, morning everybody. I'm Paula Gardner. I'm the Operations Director at Barker Leeds. So our organisation works with a whole range of different vulnerable people. My remit is specifically around complex needs. So I work with engaged leads, with people who have housing issues, forward leads, drug and alcohol issues, people who are street homeless and or potentially street homeless. So with rapid housing pathway navigators. And then we're also running the volunteer hub in Bramley, so getting food packages out to people and coordinating the volunteers in this part of the city. And then in Barker, we also have young people and youth services that are working. So most of our work now has obviously gone to home working and telephone support for our clients in the majority, but some of our clients are more vulnerable clients. We are still having to go out and do like doorstep visits. People that are using the city centre actually going out into the city centre or wherever it is that we can try and track them down and try to support the work where the homeless people have been moved into the hotels across the city as well. So yeah, a whole load of work going on, trying to do it safely from home, social distancing and all the rest of it, and Zooming daily, lots of times.
Yeah, brilliant.
Shall I nominate James because his work links into ours as well, so some of our work overlaps? Yeah. James Allen.
Thank you, Paula. So I'm James Allen. I'm the service coordinator for Beacon. We are one of the supported housing providers in Leeds, and that includes free hostels for homeless individuals who have complex needs. I think our current experience in Beacon is that we're probably busier than we've ever been. We've got high levels of utilisation. We've got more clients in our service than we've ever had before. And I think as Paula's kind of touched on, one of our big strategic and tactical pushes at the minute is about getting clients who are in the COVID Protect facilities that the council have provided for homeless individuals into Beacon and then moved on through into council accommodation. So yeah, there's a really big push, I think, to give homeless people the same chance everybody else has to protect themselves from COVID-19. So there's a lot of multi-agency work going on at kind of the street support level, which Paul talked about. Our staff, I think, are struggling particularly with managing clients at this time and different attitudes and approaches to social distancing and self-isolation. So it's kind of tough. I think we've hit a new kind of normal now, and we've got into more of a routine as a service. We've got new procedures in, so I feel kind of hopefully we're on that upward trajectory. So that's me, and if I nominate Jez.
Morning everyone. So I'm development worker for learning disabilities at Forum Central. So since the COVID-19 pandemic, I mean, usually I'm sort of connecting into the Tenfold network and supporting the learning disabilities organisations. And since the COVID-19 pandemic, it's just been a case of weekly contact with the support, with the learning disability organisations, trying to understand how people are responding, the difference in responses between the different organisations, and then feeding that information back, and also trying to pass on information wherever I can to them in a rapidly sort of changing environment. And then at the moment, I'm also acting as a point of contact for Jane, so trying to understand what's happening in the single parent community and then feeding that information back as well. So I'll nominate Val.
Oh, good morning, everyone. It's Val Hewson from Carers Leeds. Lovely to see you all. Our big push, as everybody's was a very short time to get everybody mobilised to work from home. And we anticipated a huge increase in our calls. The priority was to keep our advice line going, which we've done. And we anticipated a huge call. An increase that came wasn't as great as we thought, because I think that family carers were really kind of just trying to work out themselves what the guidance meant. So for many family carers were distance carers, carers who didn't live with the person they cared for. Our youngest carer is 16. We have the services around young adult carers, drug and alcohol, learning disability, bereaved carers. So kind of everybody was aware of those groups of people, continued to do keeping in touch calls, but actually a lot of our carers were getting a huge amount of keeping in touch calls from various people around the city, which was good. But then the advice line started to pick up then, and what it was people's fear about the interpretation of the government guidance and what people were able to do and not able to do, especially around people who were shielded and people who were very vulnerable, who were caring for somebody who was in the shielded category. So that was a really big push that people were trying to tell us. They needed, if you like, permission from us to say it's okay to go and look after your dad. It's okay to drive 100 miles and go and make sure your mum's got nothing. So there was a real practical problems that were just really fearful for people to use. That really does continue now. The big push for us now is making sure all of our services are still up and running, because carers who are in touch with us so regularly, everything kind of closed down all at once. And there was a message that people were saying, you know, don't go to the hospital, don't ring the GP. And carers were floundering. We found our new normal on how we're delivering and diversifying the delivery of our service. But that's, you know, a big team of staff all doing that. So there's a commitment there. But now I think what we're finding is people who are struggling, caring for people at home and struggling not being able to get out and make sure the person they care for is well. And some of the things that are coming back are really pretty upsetting to know that it's the social distancing, the personal distancing, that people can't get into homes to actually look after the person they care for. So it's there's a lot more calls coming in now, and we're just looking at how we can actually get online and engage with all the support groups and the wellbeing sessions we did. So I'm really interested to hear what you're all doing and how maybe we can help each other to be able to contact and make those contacts with so many people out there in Leeds, many of who will not know that they've actually taken on massive care responsibilities post-COVID. The other big issue is care homes, which is a huge issue with many of our families at the moment, not being able to visit, and also care homes and the huge increase in COVID and deaths in care homes and the bereavement that people are suffering because of that. So that's Carers Leeds. I nominate the lovely Carl Whitty.
Thanks, guys. Dave Patterson from the Leeds Food Aid Network, also chair the Leeds Homeless Charter. I've never been so busy, to be honest, since we started. Currently trying to register for a test, and it's I registered before 10 o'clock, and it told me that I can't get on until November, which is a bit worrying, because I've had a cough for the last 4 or 5 weeks. So that's just some of my kind of personal story, really. Have self-isolate, but now come out of it, but can't go back to the crypt. Obviously, the crypts do work in the hotels. I do that in my separate job. In terms of food, there's loads going on in terms of food, but there's lots of challenges as well. Food is massive. I think so much, I don't know if I'm correct, but so much people's working time seems to be around getting people food. And being on a call yesterday with Oblong and Hyde Park Source and the Rainbow Junction, it really came to light that there are some real challenges with the welfare support scheme, which I think has been very creatively done. It's run on a traffic light system. If you're red, you get a delivery direct from the warehouse run by the council, Fair Share Yorkshire, and supported by Food Revival. If that doesn't work, you get linked to one of the community hubs, which themselves have their own source of food, or they try and source your food from a food bank. And then we've got this green system, which I think kicks off today, which is about trying to link people who can pay for food. And if they're able to do that, then a volunteer can source a voucher, which can then be used to buy the stuff, take it to their house, and then the person gets contacted a couple of days later by the council, and then they can reimburse. But I didn't realise that hadn't started. There are some real challenges that we're picking up in terms of food parcels being very sporadic. And if you have any feedback, then you can obviously tell me on this call now, or you can email me or my colleague Mary, and we can try and feed that back. I've got a conference call at 12 today where we're going to feed back quite a lot of stuff. There's also been another delivery system run with We Care Leeds, Joseph Battle, which has been a godsend really, because that's and that helped. That was kicked in from the 19th of March. We're doing quite a lot of support for the hotels, just in terms of snack bags, really encouraging groups not to go out onto the street. We've got one group that's still going out onto the street, and the police will be dealing with them. Another police have dealt with one other group. But we've managed to negotiate with them that they will provide some stuff for the hotels, and the Leeds Rhinos Foundation will collect. There's a lot going on, but yeah, any feedback is something you can give to me on the issue of food.
Brilliant. And who are you nominating?
Who am I nominating? Who hasn't gone yet? Wendy, have you gone yet?
I haven't. Yeah, thank you. So I'm kind of here with two hats on. One, as the up till the last few weeks, the manager of Leeds Autism AIM, which is one of the communities of interest, and also from AdvoNet point of view. So we've just done a kind of summary from all the different service areas within AdvoNet. Val, the issue with care homes comes up so much, you know, for people that are contacting us, carers contacting us. I think it'd be useful to link in on that. The amount of people with mental health deterioration, particularly in the learning disability community, but wider than that, the issue of people's rights as well, and making sure that we're really clear. We're going to try and do a poster this week, it might end up being next week, of just a reminder about legislation and rights, because I think some things there's been blanket changes for people where their rights have been eroded, and I think everyone needs a reminder about what people's rights still are at this time. Lots of food bank food issues, similar sort of issues that have been mentioned, but I can share that summary report.
Yeah.
If that would be helpful.
That'd be really
but
helpful.
Because we deal with so many vulnerable groups, if anyone wants to contact us directly about to ask any questions about what we are getting less referrals, even though we're connecting with people remotely, people who have issues that they considered urgent previously might just not have the headspace to deal with some of those issues now. So the new referrals we're getting are around different types of things at the moment. But be really happy if anyone wants to email me or get in touch with me about issues that we're seeing in advocacy, then please do. Yeah. Around Leeds Autism AIM, I know Luke's here to represent AIM. And Luke will go through more of that. We're seeing an increase in mental health issues, high anxiety. Again, questions about clarifying legislation. So the learning disability and autism guidance that came out, that you said you could go out more often than once a day for exercise, but it's really vague. It's all vague things about if you've got a care plan, those kind of things we've done guidance on. We've got some really excellent toolkits, one for professionals, one for autistic people. It's got everything on there. And then to do with advocacy in general, please just contact me and I can send on.
That's so helpful, Wendy. Yeah, and Luke, do you want to go next then?
Yeah, sure. Yes, I'll expand on what AIM are doing and what we're experiencing. So there is a lot of anxiety about, you know, the lockdown, how it's affecting autistic people, you know, knowing what they can go out for and how often they can go out now. There is some guidance hidden in the depths of the gov.uk's FAQ page on the coronavirus. It says you can go out up to 3 times a day if you're autistic or have a learning disability. To make it easier for people who might need to go out more than once a day, you know, just to help with their routine. We've produced an alert card that they can use on their phone. You know, it's got a link to where it says you can go out more than once a day on the gov.uk website. And it has a list of reasons why they need to go out. That's been downloaded several hundred times. It's actually being used nationally.
Excellent.
We've had universities and so on use it. And even West Yorkshire Police have been complimentary about it, which is something. In terms of communicating with our clients, we've just started doing it remotely using things like WhatsApp and email and phone chats. We've done that for things like our post-diagnostic support, our peer support, and some of our advocacy work. Obviously, we've not been able to run our drop-in hub. We have, every Tuesday, but we are looking to bridge that gap by doing stuff remotely. Shall I nominate someone?
Yes, and can I just mention we've got information updates on different service provisions, so do send those in to the Forum Central website and use that to catch up on each other's services.
I'll nominate Karen because she hasn't gone yet.
Well,
Thanks, Luke. Yeah, hi, it's Karen. I'll be relatively brief. So my role's similar to that Carl and Jazz are doing at the moment at Forum Central. So my priorities are around mental health and physical and sensory impairments. So working with Caris from Leeds Society and other people on this call to make sure that we're looking at communities of interest for people with mobility issues, those with sight and hearing impairments, long-term health conditions, and also mental health. But yeah, that's what I'm doing. Shall I nominate Jane?
Just unmute myself. As you know, Home Starts supports families through volunteering at the moment, as home visiting's suspended, of course, but we're still giving telephone support. That can be weekly, or in some cases it's been daily, where we've where there's mental health issues, especially around perinatal. What we've found is that, we're getting lots of information out from the forum and Val and Young Lives Leeds. The difficulties that we've come up against is with the welfare, and I think I've spoke to Jez about this, is that if you email in, a lot of applications are getting lost. We've had things delivered to the wrong door, and then people have gone to the back of the list. Luckily, we've got a small pot of money from Home Start UK, and because we're funded by Children in Need, they are extending their grant facilities for people who are already with them from the beginning of this month, not just for essential items, but for some related with children with the COVID-19. The main thing that we've had, again, is around mental health, isolation, lack of baby food. I think nappies is a little bit better now. Yeah, so I think that's the main thing from Home Start. We're just adapting different ways to deliver the service and also support the volunteers and doing different learning. We're looking at different ways of doing learning and development. Next. I don't think it helps not having the sunshine, because at least that gives you a bit of brightness. Yeah. But yeah, that's us. I'm trying to think of somebody who hasn't been.
Let's go Annette then. Annette, do you want to go next?
Yeah.
Hi everyone. I've been obviously I work for Voluntary Action Leeds and lead on the BME hub. So my area has been looking at what's going on within BME communities and how COVID-19 is impacting them across the whole spectrum of BME. And we've been working with Forum Central and with Leeds City Council's communities team to bring that information together to hopefully make some sort of an impact on future strategy and what's happening now. So I've been gathering a lot of information, and some of the things that you've already said that kind of seem to be cross-cutting themes. So mental health is a big one that's impacting on BME communities. The food situation, one of the biggest issues is cultural foods, with the food banks not being able to access cultural foods. So some organisations have applied for funding and been able to purchase cultural food to add to the food bank food, so that's been really useful. Also period poverty within BME communities, so we've been able to support community organisations to access the sanitary products and get them into food to the food parcels that some of the organisations have been sending out. So a lot of the issues are cross-cutting, and some of the communities feel quite isolated as well, and disproportionately affected by this whole situation, with the evidence coming out around BME communities being disproportionately affected by COVID-19. That's quite a big worry for communities. So that's something I think is going to be a long-term thing, and there's a few opportunities for people to get together and discuss that, which is going to start, I think, next week with some of the BME hub reps who want to come together and look at that for the future. So yeah, that's just a snapshot of some of the things that we're discovering with BME communities. But domestic violence, again, is another big one that's happening, and not just with adults, but with children as well. So we're finding out that some children who are in particularly multi-occupancy homes are experiencing abuse and violence as well. So that's, again, all these emerging issues are coming out, and we're discovering them as we go along.
Hi, good morning everybody. I'm Carrie Screen. I have recently, as in the 9th of March, started with the Leeds Society for Deaf and Blind People. So it's been an interesting start, not quite the one I expected. But we have also mobilised the service that's being delivered. So we are delivering our services still through video calling, WhatsApp, basically any methods really that are appropriate for the users. In terms of other things that we're doing, obviously linking in with the community through other methods, so Facebook, etc. I'm sure similar to other people as well. And if anybody's got anything that they feel we could support with, or that links in with the community that we particularly support, please do let me know, and I'll keep it short and sweet because I know you're conscious of time.
Oh, appreciate that, Caris.
Thank you.
Damien, would you like to go next?
Yeah, sure. Hi, everyone. Thanks for having me along. My name's Damien Daughtry. I work for Feel Good Factor on the Better Project. I also work as part of the Orion Partnership in East Leeds, working on an ambassador project supporting men by businesses throughout East Leeds. And I've been asked to come here as someone who has maybe a bit of an overview and in touch with the men's health and men's work across the whole city. So I can offer some sort of macro stuff about men's health and the being up to 3 times more likely to die from coronavirus, and things like ethnicity as well. You know, ethnic minority men more likely to die as well, as Annette touched on, I know. And also the more micro stuff as well about what people are doing out there with online groups and things like that. And interesting that people being becoming a lot more tech savvy, necessity being the mother of invention, of course. So yeah, I'm happy to chip in.
Thank you.
It's useful.
Yeah. Charlotte, would you like to?
Yeah. Hi everybody. Good morning. I'm Charlotte from Leeds Gypsy and Traveller Exchange. I'm the community health coordinator. So we've been supporting the Gypsy and Traveller community. We've been looking at people at all different age ranges. So we've been doing a lot of welfare calls to our members, looking at people that are more vulnerable, looking at elderly, and supporting the youth with home education. We've also been looking at, we've got a high rate of people that are self-employed within the community. So we've been supporting them with anything that they might be entitled to. And also, like Damien said, within the ethnic minority, people have got more likely to have underlying health issues. So we've been looking into that and trying to give people more support around any underlying health issues through Facebook, making sure that they're still getting the health support that they need. We've been contacting people through Facebook, social media, and through a lot of welfare calls.
You did a great video, didn't you? You were on Twitter doing a really good video. I think so. Yeah.
All right, yeah, it's gone up already then. Yeah, we've all the full team's been doing a lot of videos, just trying to communicate with people in different ways, making it accessible for everybody.
Brilliant.
Yeah.
Oh, thanks, Charlotte. Sally, do you want to go next?
Hi everybody, I'm work on strategy for Women's Lives Leeds, and I'm here really to see what's going on. I try and have an overview across our partnership of 11 organisations, and it's really interesting to hear what everyone else is doing.
Thank you. Stuart?
Yeah, hi, I'm from Healthwatch Leeds. So our role is quite similar to that of Forum Central in respect of ensuring we're gathering views of people during this time. So we've been working closely with Pip and Carl to share the feedback we're getting with them. So our staff are phoning organisations to speak to service users recently with a specific focus on faith organisations and disease-specific organisations, because we're aware that people are not maybe accessing NHS or social care services at this time when they could and should be. We're doing weekly check-in surveys. The focus in the next couple of weeks will be around mental health, and these feed into the Partnership Executive Group and Gold Command. And I think they really value the real-time experience, because this is weekly stuff that's quite detailed. Tim Riley, the chair of CCG, just gave an example yesterday that they've now built a mechanism for care homes to feedback on a weekly basis on whether they're getting GP support. That comes from some of the stuff that we've shared with them. And our volunteers, we've got volunteers now helping Carers Leeds to do a bit of the maybe food shopping and things. So we're trying to do a bit of everything in feed them. So if you have anything, feed into us and Forum Central, and we'll make sure it goes to the top.
Brilliant, thank you, Stuart. So we've got Sam, Owen, Daisy, and then we'll come to you last, Rachel, because you're going to then speak a bit, if that's all right. So Sam.
Morning, everyone. I work for the Leeds City Council's communities team. I work in migration. Priya and I have been linking up with migrant third sector organisations during this time to understand what issues their clients and their organisations are facing. We've also been, part of what's been really key is ensuring some of the key messages are reaching our third sector migrant organisations. There is a lot of information that's been circulated and has been put on the Leeds Migration Partnership website, but because I think people are challenged and to pick up on everything, so we're making sure some of those key things are being picked up on. We do think that some organisations perhaps aren't referring, so we'll be having conversations this week to try and increase that. We've also been getting information translated into different languages and created videos with public health that have been available on YouTube that has been translated into key languages for the stay home and stay safe messages around key health messages, making sure that gets to communities. I think the key concern, which would be my last point, would be that a lot of the support that's been put in place, the migrant third sector have really recognised the great response that we've had in Leeds, and where immigration status is no longer the focus, people are just getting support. But there are concerns about what will happen when we go through this period and go back after lockdown.
Brilliant. Nick, would you like to go next?
I'm Nick Peasgood, Chief Executive of Leeds Women's Aid. So I'm representing domestic violence and abuse. I'm also the lead agency in the Women's Lives Leeds partnership, and we are the lead in Women and Girls for Communities of Interest. I think the main things are that we haven't seen a huge increase in helpline calls because people experiencing abuse are often locked in isolation with their abuser. So we're trying to reach out and extend in terms of live chat. We've seen a 60% increase in website visits, so people are reaching out in different ways, which is good. In terms of the wider partnership, we've opened up an Ending Violence Against Women forum, so if anybody wants to kind of join that, Sally is coordinating that one. We're doing that weekly just to get an idea of what's going on in the wider sector. We have some issues around refuges being full, and when we are getting vacancies, if it's in our shared refuge, because it's a single household, we can't bring new people in. So that's causing difficulties in terms of the huge demand for refuge space, but also we're losing quite a lot of money because we can't claim housing benefit for empty properties, and we can't fill the properties, so we're in a bit of a difficult situation at the moment. In terms of the wider women and girls sector, there's increasing evidence that women and girls are disproportionately affected by austerity and by some of the difficulties that are going on at the moment. But as everybody else says, we can share information out of this meeting.
Yeah, thank you so much.
Hi, I'm Owen Walker. I'm the manager of Leeds Autism AIM. Like you said, I think Wendy and Luke have already covered most of what Leeds Autism AIM is experiencing. So I'm mainly here to kind of listen and absorb and add anything if need be.
Brilliant. Thank you for joining us. It's so brilliant to have so many, and just what a breadth of perspectives, really valuable. Daisy.
Hi everybody, I'm Daisy. I'm quite new to Forum Central. I've been supporting with admin and communications as well across the team, and mainly around the communities of interest work. So I'm sure you've all seen emails from me, so it's nice to put faces to names.
Thanks, Daisy.
Hi everyone, I'm Ali from Leeds Older People's Forum. We're calling round all of our members, who include the neighbourhood networks and organisations that work with older people, and the Time to Shine delivery partners. What we're finding, and especially with the neighbourhood networks, is that after the initial shock of lockdown, old organisations working with older people, you know, quickly got things like volunteer befriending up and running. They got food parcels up and running, things like shopping up and running, pretty quickly. But now things are beginning to settle down. They're looking at other ways of supporting older people across the city. There's been a lot of stuff around moving towards online, but that raises big issues for some older people around digital exclusion. And you've probably seen a lot of stuff around digital inclusion being, oh, it's great, and you know, lots of great work has been done around getting older people online, but there are a significant number of older people who don't have access to Wi-Fi, don't have access to the tech. And so there's a question of actually, how do we work with older people who don't have that access to maintain their connection with their communities? Providers are delivering things like sewing kits, delivering seed, films, all this kind of stuff to try and keep older people engaged. In terms of mental health, it's a really mixed bag. Some partners are reporting that there are some issues around mental health. Others are saying, well, actually, at the moment, there aren't big issues around mental health. People are focused on a 12-week lockdown. Issues may arise then after the lockdown, or if that is extended for people over, say, 70, then what happens longer term in terms of support, and then what is the impact on mental and physical well-being?
So the different waves of impact is really important, isn't it?
Yeah, and one of the things, just to finish up, one of the things we are looking at is what COVID has brought out is the glass through which some people look at older people in our society around ageism, and the whole ageism thing of how the approach to COVID-19 has been addressed. And so we're doing some broader work on that as well within Leeds Older People's Forum.
And Rachel, I think, is that everybody? Yeah, Rachel, would you like to say a little bit about your role? And we're delighted that Rachel was able to come along to say a little bit about people who are shielding and answer any specific questions, because obviously that's a particular kind of area of important focus.
Yeah, so thanks for having me for a start, and Ashley, it's just been genuinely amazing to hear so many of those stories, and I've had to just be in and out a little bit, but the things I have heard have really kind of reassured me, if it's possible to be reassured in these times, that that kind of amazing people are doing amazing things. So for me, my job has been to try and help the council and the city provide an effective response to the shielding programme. So within when kind of social distancing and all those measures were first announced, there was quite a lot of talk about people who are vulnerable to COVID, and that includes that kind of people aged over 70 and with various different medical conditions, and that was about 214,000 as a best guess of people in Leeds. So then shortly after that, then there was announced that there was a bit of medical review about what are the specific medical conditions that would make you extremely medically vulnerable to COVID. So it means that if you would contract COVID, you're more likely to have complications, and therefore you're more likely to also die from it. And that this list of conditions came out, and that works out about 22,500 people in Leeds, based on what we can guess from the Leeds Care Record. We've been told that so far The government has sent out 18,000 of those letters, and we expect more of that will have been done now. But at the moment, only about 11,000 of those people who've been sent a letter have confirmed they've received the letter by going on and registering on the national website. And so obviously there will be people who will have received the letter, fully understood it, absolutely fine with doing anything, but didn't register on the national website. I suspect, however, because it's a letter sent to your registered address, it's not a particularly easy to read letter, it's not a particularly easy to understand letter, that there will be a higher proportion in many communities of interest of people who have not received that advice that they should be shielding. And again, for all the reasons I think I heard somebody talk about there in terms of legalities and civil liberties, I do have to keep stressing to people that this is advice, advising people to shield, and they can choose for themselves what to do. But the bit I would really, really be keen to hear is about, how can we improve the kind of knowledge and understanding that if you have received this letter, what it means, and what help is available to enable you to continue shielding safely. I'm very worried that kind of national messages around kind of going out for exercise and all of those things, that kind of those big messages conflict with the advice for shielding. And I'm also particularly worried that the advice around kind of, if you get cold or flu symptoms, to treat it conservatively and stay home and not go anywhere and not seek advice, has been again missed. And the fact that if you are shielding, if you are somebody with these specific medical conditions, you must seek medical advice as soon as you develop any symptoms. So they're really, really important messages to get out. And so whilst we have, like I say, we've got contact details for the 11,000 or so people who have registered. For those who've got mobile phones, we text them and say, here's the helpline number, if you need anything, come back to us. For those who've got email addresses, we've been able to send out information on here's the help that's available. But all of that is fully imperfect. For those with landlines, we've managed to make about 800, 900 calls for people who are landline only. And then for a smaller number of people, we've sent out letters to follow that up. But even that, just it worries me that there is huge cracks in that process. And so I think as organisations, you will be and groups, you'll be in contact with people who, you know, and I know even from my own kind of life experience, people said to me, oh yeah, I did get one of those letters, yeah, didn't pay any mind to it, or, you know, oh, I got that letter, yes, I'm being extra careful when I go out and do my shopping, and, you know, so that things like that kind of make me worried enough that the message isn't clear enough. But so what I was really wanting to do was get advice from you guys about where you think we might be able to improve advice and information about people who've been advised to shield, and if you would be willing to help people register nationally, that then helps us to know. But then also kind of any specific considerations you think from the communities of shared interest that you work with, that it would be good to think about in terms of providing support. I think that's everything.
That's really helpful, Rachel. I think that kind of gives a really helpful overview. I think there's some data, isn't there, about geographical areas, and we know that there's lower reporting, you know, and they're perhaps some of the areas we might expect. So some of the areas where, you know, people are, you know, there's a sense of people living in areas that are more deprived, and there's a lower take up of the support available, because there's some really key important support, isn't there, around emergency food and shopping, picking up prescriptions, welfare, and also the social support that Leeds Older People's Forum actually are beginning to kind of help set up a network of support. So the real
the thing for me as well is we need to get that absolutely solid as well, because when lockdown ends for general population, we expect that the advice to shield will continue, and so a lot of those systems and things like that are a little bit fragile, and people might think that they're not there anymore. So I think it's kind of, we're in that really, really important period now before lockdown ends to reach out to people and really make sure they know and understand those messages, and they've got those kind of, you know, plan A, plan B, plan C and plan D in place for the help that they will need to help them do that.
Brilliant. So some really important messages there. Annette, did you want to come in?
Yeah, just say that with regards to the shielding message, I think that there is a lot of confusion, particularly among BME communities, because I fall into that category. I got a letter, I'm shielding, I registered on the site, and realised when I got the letter and the information, this is quite complicated, quite complex. And in the feedback I've been getting from some of the communities, a question was asked about shielding and about whether people, and I got my letter quite late, so I was still going out shopping, being careful, doing all of that, and then got the letter and thought, oh, dear me. And some people have been asking, how do we know if we're, if we're supposed to be shielding? I've got this condition, I don't know, I've not been told. And also that process of registering and the language that's in that letter isn't necessarily user-friendly for certain groups. So I think that's probably one of the issues why people are not registering onto the site if they've received a letter.
I think a really important element that we can all bring in this work is making those connections between, we've got some brilliant stuff happening in Leeds. We've got a really good local offer. Some of this is national, but the local offer is really good. But what the concern is that there are people who will really struggle to access that. So it's having that connection and that relationship in to those.
Yeah, and I'd like to know the person that letter was in fact designed for, because I think it's really impenetrable, and even the process of registration is very confusing in terms of the way it asks questions. So one of the real inconsistencies in the approach is, in order to be able to book a priority delivery slot with a supermarket, you have to register and say you've got no other means of getting food and supplies. And when you say no to that question, then you then automatically send a standard basics food box. So whether that's suitable for your dietary requirements, your medical needs, your family needs, and so people are so confused why they're being sent that and not, and so many people as well who have heard this word shielding and have kind of thought, oh, I'm over 70 or I'm this or that, and I have medical conditions. And
sorry, just a quick one. Can I confirm that there's a lower take-up of support in deprived areas?
So so again, it's a little bit more circumspect than that, but in terms of, we've got about 53.5% of the people who've been sent a letter who've confirmed that they've received it. So that's not the same thing as taking up support, but they've confirmed they've received it by registering on the national website. And then in the areas that have got less than that 50% threshold, you would recognise them as being areas that have got high levels of deprivation. So, but it's not a linear. It's not like the most deprived have got the least, because also in terms of people, there is a higher number of people with these conditions living in those areas as well. So the percentage is down. Yeah, Yes, I think it's the shorter answer. Yes, I think we're worried. I can't tell you by ethnicity, but I can tell you by age. But we know that there's a lower take-up, or lower confirmed registered, both in upper age brackets and very low age brackets.
Yeah. Did you say it was only particular people that are receiving the letters?
So yeah, so it is actually a really specific set of conditions. So, if you've had a solid organ transplant, for example, if you are on a significant dose of immunosuppressants for autoimmune conditions, if you're in current high-level cancer therapy for some cancers, so it's not even all cancers. So it is, like I said, it is very specific conditions. Now, the first range, basically the first set of people who were notified were people who have got those conditions already diagnosed and notified on their medical records. The second lot of people that got notified were by kind of hospital consultants going through their lists of people that they were maybe about to diagnose or who they've got concerns about, and they wrote to those people. And then a third wave was GPs going through their lists and saying, on balance, this person doesn't have any of these one conditions, but the combination of, say significant asthma plus one other condition plus something else would make them, they think, extremely medically vulnerable. So that's the kind of the waves. So not everybody was informed at the same time. There are still people being informed now as well, much smaller numbers, but that's part of the problem, that you can't just say a definite yes or a definite no. There's some people who are a definite yes, but a lot of people you can't say a definite no, you shouldn't be shielding to. She was talking about family carers who don't live in the same household,
yes,
and they're worried about bringing the virus in, and I too am worried about that. And we've been looking at different models of getting PPE to people who are not professionals, but who might want to have some aspect of PPE when they're caring for their loved ones. So I think definitely let's pick that up, because I think it's really useful and helpful.
Yeah.
I've got a quick question.
Brilliant, thanks, Sam.
The clients that you were talking about, the people who are extremely vulnerable, are they the ones who should be shielding, or is it also the 214,000?
No, so the wider 214,000 is strict social distancing. And the thing we should probably say as well, which is that shielding is not to be undertaken lightly. It's a really significant thing. So if we think about how badly we're all reacting to lockdown, but we still have that ability to go out, choose our own food, quite frankly, pick which, vegetables, all of those things that we forget just to do us good, is really important. So I think that's the bit I would really like to kind of stress to people, that there's no halfway house really. For shielding to work, you really have to follow the rules as strictly as possible. So it's the 22,000 people are shielding. The bit I think I would want to talk to you a bit further about is, because that's all done through NHS records, I think there will be a significant number of people who are both not registered for the NHS or who have no recourse to public funds, who may know they've got these conditions, in which case let's find a way of getting help and support and assistance to them without them fearing for their immigration status. That's something I'd like to follow up
I was
on.
thinking, Rachel, that it'd be really useful for you to come to the next LMP meeting and talk to some of the partners. Unfortunately, there was one yesterday, and I'm not sure if they're weekly or 2 weekly, but get in touch with John and link up with you to try and bring you in on that.
Yeah, definitely. So I know. So we developed like a routes to support document, and I know it's not that easy to kind of read, but that's the thing that I would love every single one of you to basically have just available anytime you're talking to somebody who thinks they might be shielding or need to shield, and that gives you a bit more information about how you can help them sign up and register, but also the support that's available. But yes, definitely, Sammy, absolutely happy to do that.
I think that brings us into resources and communications and things that might help. So Daisy's been sending out a weekly email, as well as the kind of direct contact that everybody's had. So perhaps if we can kind of come on to thinking about what we're doing with all of this information, and also what would be helpful for you to kind of help us work better together. Paula, I'm conscious that you mentioned you'd got to go. Is there anything you'd like to say before you mentioned you'd got to leave a little earlier?
No, not particularly. Just like anybody else, if there's anything I can support with, I'm happy to. It's just really useful to hear what's going on across the city. There's so many different elements and vulnerabilities, isn't there?
I know.
You kind of get honed in on your own bit, and you don't always realise exactly what else is going on. So it's been useful. But yeah, I haven't got anything specific at this point. But if I do, I'll feed it in.
Thank you. And that in itself is incredibly helpful, isn't it? That sense of kind of that sort of shared resource and knowledge, and the fact that we have got each other to link with and that we can work. And that touches on the point that Nick was making about kind of, intersectional kind of working between our different kind of areas. So that's, a really important thing, I think, that will come out of all of this. Is it helpful to say a little bit about, so I think we're kind of clear, there's a real sense, isn't there, of the value of us working together, of us getting and capturing the issues from different networks and communities of interest, but also of sharing that and kind of bringing issues together. So a really important piece of this, and it's absolute partnership work through and through with Voluntary Action Leeds and Leeds City Council, Healthwatch, really kind of powerfully bringing together those different perspectives as well as all of yours. And we're collating that into a weekly overview report. Carl, would you like to say a little bit about that? And I don't think we want to put it out there on our website, but it's definitely something that we can share back with each of you. Do you want to say a bit about that, Carl?
Yeah, so I suppose one of the challenges with producing that report is that there is so much information, and I'm conscious we initially wanted to produce a really short, sharp report, but because of the information that has been presented, the challenges, the positive things that are happening, it's ballooned into something massive. And I suppose my concern is some of those issues which are really pertinent within particular communities might be lost. So I think we need your support to make sure that it isn't just a single report which is communicating all of this work. And also kind of forum like this, I find it super useful, just speaking to everybody and getting that broad overview. And I think that helps me tease out the priorities which do cross-cut. We've talked about how the value of segmentation, particular communities do experience different things, but there are cross-cutting issues, and communities aren't just homogenous either. So, for example, within learning disabilities, we've got high rates of long-term conditions, disability, mobility issues, caring issues. So it's not just as simple as saying this issue is for a particular community. There are going to be cross-cutting issues and complexities within each of those categories. So we'd like to share the report with you and get your feedback on whether it is appropriate. And we'll be kind of trying to make that report evolve to make it more effective in communicating to the people who can make decisions.
Because that's the absolute key bit. Obviously it's really good that hopefully it's helpful to get information flowing out through you to different communities and individuals and other organisations, but it's also really important that sort of flow the other way, that people get to kind of hear what the issues are and that something different happens because of that. People like Rachel who are completely feeding in information that's coming back from communities into some of the decisions that are made for the city. So there's the central hub and then all of the different locality hubs out in each of the areas. So being a resource for each of those and making sure that we're helping flag so that they respond well to the different communities. But also key decision makers. So Stuart mentioned the fact that care homes are a huge area of concern and making sure that there's an absolute priority around testing for those areas, but also through us raising PEG, we were able to get that information out about getting testing for people from the voluntary sector. So people like Dave able to get tested, really making that clear that people working in third sector organisations are really integral to the kind of health and care system response. So if there are other things like that, specific things, we're making sure as well that all of this work is a real opportunity for the health inequalities to be really seen in the city as an absolute priority for how we reshape things coming out of this as well as the immediate response. So I think that kind of commitment, the value at which the third sector has been able to mobilise really quickly, and people have just seen how willing and able and well connected and well networked the third sector organisations are. So it's how do we really use that to benefit people that we're all working with.
I think there's a bit of how can we understand how the compound of inequalities have caused people that you were in contact with to have suffered more, and therefore before we start to remake things and start to plan recovery, what can we learn from what your experience has been, so that when we start to reopen things up again, we can actually put them back right before we put back the same conditions that were causing inequalities. That, I know it's a long way around of saying it, but I think there's something in that massive learning that you guys have got right now, and that I wouldn't want it to be, wasn't the third sector handy during an emergency? I wouldn't want that to be the message. So whatever we can do to amplify those voices, I'm really happy.
I suppose there's some really good work doing connecting people who were previously isolated and not in services from everybody And that's a real concern of us,
Yeah.
because I think all the services are being so proactive in finding different ways to maintain contact, do wellbeing checks with people that they've worked with. Those people who are isolated from services, who've fallen between the gaps, is really work we need to identify, reach them, and this is a good opportunity.
Yeah, it has. I mean, in some ways, it's been really good for older people's services, because they know that there are isolated older people in their communities who they've been unable to reach. But now, because of practical needs, those older people are coming forward, or neighbours are saying, you know, Mr. So-and-so next door needs your help. But actually what they're finding is that, you know, these very isolated older people often have mental health problems, other physical health problems, and actually have a complexity of need that, as you know, maybe as a neighbourhood network on their own, they're not necessarily able to provide the support that they might need. So in one way it's good, because they're extending their coverage and, you know, reaching more older people, but actually it's increasing pressure on their organisation to meet a level of need that they're not set up to do. And I think that's something that certainly from these older people's forums point of view, we will want to look at in more detail, because obviously that will have implications on not just other local voluntary sector organisations, but also the public sector provision as well. So that's something that we're keeping a watching brief on and are going to investigate further once things are settled down a bit, because at the moment older people's providers, like everyone else, is just really manic trying to meet need on a daily basis.
Absolutely, yeah.
But it's an ongoing concern, and neighbourhood networks certainly are flagging it up with some concern. The other issue actually that is issues which relate to the shielding letter actually, Rachel, around illiteracy, and older people on their own maybe just thinking, oh, not opening the letter, not being able to give it to someone to read. So that's a massive issue actually. And talking to GPs on the phone, not understanding what their GP has said, you know, if they're very old maybe, and if they have dementia, it's really problematic.
Yeah,
But
no, I think on those 2 points, I think it's really, really important, and we have fed this back, but it is the fault of the person writing the letter that they are not communicating in a way that can be understood. And I know we put BSL as Sign Live on the helpline, but actually there's a bit we've discovered around people who are hard of hearing, and particularly when people are wearing masks. The number of people who didn't realise that they were kind of half lip reading for a lot of the time has been a huge issue. So I think that's also something that we really need to put in as a very specific thing. We'll talk about the absence of the signing on the national televised press conference every day on another day. BSL is not the answer to people not being able to hear, and easy read versions of complicated letters is not the answer to doctors and medical professionals and public sector writing letters that cannot be understood by people with advanced degrees in communication. So I think that's the bit we need to stop, you know, squirreling, the bridges and tunnels analogy from Leeds Gate. We need to stop that. So I think there's a bit of what can, you know, the bit of that's the bit I'm saying about harvesting the learning, which is, if we had done it in this way, it would have prevented these problems. You know, it's great and it's amazing, and I want to, you know, I'm applauding so many people who are making and building workarounds. I am building workarounds every day. You know, I'm reinterpreting national guidance. But all of that was, you know, if we had been good and we have learned now, let's not do an inquiry as why we've not learned this before. But let's say if this is something we can learn from it, this would be really helpful going forward. So I think those would be really great messages to hear coming out of Forum Central, and we'll be able to amplify them.
It'd be really good to have, you know, instead of, it's good that it's easy read versions of documents, but you know, none of us want difficult versions, do we? You know, so often those things are just set out in such a complicated way that all of us want it simplified. And some people don't classify themselves having a learning disability. They don't think easy read versions are for them. That would be a really good learning to take from this, that we all want simple, clear, bullet pointed guidance, and we shouldn't have to ask for an easy read version. That would be really helpful. There's also the the support that's needed, the training in kind of communication support from, if people have a minimal amount of support work going in, to help them to connect online, to help them to understand the letters and things like that. Maybe that's something that some of the volunteers are doing through VAL as well. But understanding communication differences more widely would be really good to incorporate in training for those volunteers.
And I know, yeah, some work is being done around that training. And I know Karen has offered some resources as well to the central phone line and kind of made some of that connection too. Are there any other kind of particular questions in relation to the conversations that we've had, or other things that people are thinking? Damien?
Yeah, I suppose listening to everyone, I think we've got two things here. We've got, not surprisingly, the immediate things that we're all dealing with, and many of us are absolutely clearly quite swamped with dealing with those things.
Absolutely.
At the same time, trying to have an eye on what might come afterwards for those who come out of lockdown as well. In terms of the present, I think I'm concerned that particularly amongst ethnic minorities, we get a lot more sort of crowding, multi-generations living together and things. We've got some real pressure cooker situations going on there. For example, we've heard about the rise in domestic abuse for women as well. It's the same for men as well. The National Men's Domestic Abuse Hotline has gone through the roof with calls there. Leeds dads are reporting that their fathers have relationship breakdowns, not necessarily with their partners, with their children as well. And that's that pressure cooker kind of thing going on.
Yeah,
that's across all ages, and rightly we focused a lot on the older people because of the shielding and things, but we must bear in mind there's other generations too. And then looking ahead, of course, when we come out, for those of us who have time to do so, is anything we can do about preparing for that? Because we know we've got a recession around the corner. From a men's point of view, I know that the last recession, suicide shot up like extraordinarily. I think it was like from about 120 to 500 or something like that. For every 10% unemployment, suicide rose by 1.2% amongst men. That's just that angle. I'm sure there are lots of other issues to take into account as well. That's it, really. Just prompt for discussion, perhaps.
Really important reflections. Thank you. Anybody else? It is always just great to kind of meet and see people and make connections, isn't it? And to kind of hear what other people are doing. In terms of support and information from this sort of partnership piece of work, obviously those reports will feed in and we'll let you know the outcomes of those. We're in the process of setting up a page on the Forum Central website so that we've got information all in one place. We've actually got some funding. There's a small pot of funding. If anybody for their organisation, if it would help you to do this work and to support this communities of interest work in terms of linking with other organisations and with the people that you're connected with in your networks, then we've got it's probably be around £1,500 per organisation, just as a flat amount to just kind of help recognise that this does take time. And I know money doesn't help, it's time and people that are perhaps needed more than anything, but recognising that in these straitened times that might just be something that kind of helps make it more possible for people. So do let us know if that's something. Are there any other reflections about the information, about the kind of email information, the bulletin from public health and from social care that we've been sending out on a weekly basis, or any other kind of reflections on what would help? Are people broadly finding it manageable? I know we've kind of said some of the information is a bit confusing, but does it broadly seem about right? Dave?
I just wonder if you can put in the bulletin where we can get a haircut. I'd really appreciate that. Okay.
I think you just need your clippers and go bald.
But Forum Central, if you can speak into this, some good advice, I'd find that really helpful.
Oh, good. Well, if that's the most missingest bit, that's quite reassuring.
Sorry, it's slightly personal. We've produced a magazine to send out to people living in LS8 and LS9, them information about coronavirus with a mixture of entertainment as well, particularly aimed at sort of lower tech people who've got less access to technology, to keep them entertained, and phone lines and things for them to access. We've got a few spare, and I'm just wondering, is there anyone who has a network giving out food parcels or whatever in LS8 and LS9 who would like me to deliver a few dozen? Or
we can make sure you're linked in with the people in that area that we know. Presumably, everybody's got that list, haven't they? I think we sent that early on. We can resend that if that's useful, of the hubs in each locality. But yeah,
I was going to say as well that any information that we get through, we send it out to our volunteers, and I'm sure all other organisations are doing that. And we've been putting a lot out on Twitter, for families and everything. So again, I mean, the only thing that I'd like to say is that people have identified a lot of the things that we've been finding, around communication, the language, and as somebody else said, it's about going back to simple, language right across agencies, whether they're statutory or voluntary. And again, what people have said about domestic abuse, so again, but anything that, I have supported some organisations in giving some guidance that we've got around telephone support for volunteers. I did, in children's services and things like that. So anything really that, we can do to support each other.
And I think that's been a really strong message from so many people, is that kind of willingness, even though how incredibly busy everybody is, that sort of offer to support each other and to share kind of resources and information is brilliant. Thank you. In terms of volunteers, can I just mention, obviously Voluntary Action Leeds and the Hub, there's been a huge drive around volunteering. But also we know from the resilience survey that we've been doing that a number of organisations have seen their own kind of volunteer drop off. So if there's any issues around volunteering and any need to connect those things up, then do let us know.
Just on the volunteering, it'd be really good if Val could send out an email, because I think there's some confusion that the volunteers are led by the hubs, the 33 COVID-19 hubs. There's quite a lot of frustration, because I think it's at least 50% of volunteers have not been taken up. And I know that's because it's been oversubscribed. But getting that message out would be really helpful just to that volunteer, because they've not had anything to say why they haven't been used.
I think they have done that, actually. I think they've clocked that, and they've just been following that up in the last few days. Ali? Okay. I will make sure we pick that up, yeah.
Yeah, one of the things that Val and the council are doing in partnership with Leeds Older People's Forum is where we're actually going to be, some of the volunteers are going to be working with us on a support phone line. It's not befriending. It's going to. I think it's going to be called "Are you okay?" It's very, very light touch, so that people calling in to the Leeds Council helpline, who maybe just need some light touch support, will then be referred to the phone line. And volunteers from Val have already been emailed asking if they want to take part. And as of this morning, that email went out late yesterday afternoon. And this morning we've had around 350 volunteers say they want to take part. So a lot of those Val volunteers may be coming through on this sort of extra kind of phone line, and they'll be offering sort of weekly or daily support to people if they need it.
That's really good to hear. And another really good example of that kind of connecting up. And also things that will help create longer term resilience. One of the things I'm really kind of mindful of is, we need a third sector that's kind of strengthened and that, is valued, as Rachel mentioned, but also is fully resourced and able to kind of meet the additional demand. So it's helpful when those kind of positive things are joined up.
Sorry, Pip, is it okay to add there as well that we're offering something similar, but specifically in terms of people that might want a call in BSL.
Brilliant.
To kind of give us a call or for us to get in touch with them. And the same for
that's great, Caris. Yeah.
blind or have a visual impairment. We have been putting our phone number out there anyway, and for video calls if people do need support and they need to sign for that support. Just linking in with the points earlier, we are concerned that there is a group of individuals that maybe aren't able to communicate because they don't have the technology, and actually people aren't aware of that kind of group. So we're trying to sort of encourage some connection there. One of the things we're very conscious of is our social groups have often been quite a lifeline for a lot of people, and it tends to be so-and-so knocks on somebody's door, or they might know a friend of a friend, and then they all kind of come and meet collectively together.
Yeah.
What we're conscious of is how do we get in touch with that group of people, and how can we provide them with additional support. So if anybody's kind of wanting to link up on that, that's something else we're trying to address. But if there's anybody that uses BSL that wants some support, we're arranging things like repeat prescriptions or anything like that really. I can share the details with you of the numbers to text or call.
Yeah, do send that, Caris, and we'll make sure that that gets circulated, and linking that in with Leeds Older People's Forum. Val has just made the point on the chat about just ensuring that identifying whether people are carers and making sure that they're connected in with Carers Leeds. And again, I think that's something that we can all kind of take those opportunities to be asking, because you know, caring is a massive issue at any time, but especially at the moment, it's kind of even more critical, isn't it, that we make those connections. Thank you all so much. I know some people have got to go. It has just been so incredibly valuable to kind of hear the connections and make sure that we're linking things up. It feels as though broadly, you know, we're on the right lines with this, and what an incredible amount of kind of work and kind of passion and commitment everybody's putting into this. So enormous thanks to everybody for this. Do keep in touch, and massive thank you for coming. I think, Daisy, we've managed to record the session, so we can share that with anybody that wasn't here, or anybody that, you know, wants to kind of listen to it again. Who knows? Yeah, we could make podcasts and all sorts. We'll see. We'll see. But yeah, massive thank you and goodbye. And yeah, stay safe and look after yourselves and each other.